Lyme disease. It's become epidemic on Long Island and much of the New York Metropolitan Area, indeed in much of the United States. And as bad as the disease is, so is treatment, specifically for long-term treatment for Lyme disease. Health insurers have systematically discouraged compensation for long-term Lyme disease. Diane Blanchard, you're co-president of Time for Lyme. Why did you get involved in all this?
Out of necessity. I basically became sick myself with the disease unbeknownst to me in 1987. I was gardening in my home in West Hampton Beach, and that night I had a tick that my husband pulled off the nape of my neck, and I became a very sick lady. And I saw my doctor back in New York City, who didn't understand what was wrong with me. I had a summer flu. And essentially, I became nicknamed at work Diane So Tired, because I would close the door to my office every day and sleep, and basically my secretary would run out and get me something to eat, and I went from being an early morning runner to someone who could not even get out of bed in the morning. In addition to that, I did, years later, have children, and my children all developed Lyme disease as well. So in 1998, I became committed to this cause and decided to use my professional background to do something about this.
Apparently the situation is that people who have long-term Lyme disease, by and large, aren't being taken care of medically in this country.
Sadly, there seems to be a medical disconnect. There is clearly direction on what to do in an acute stage when a tick is found or the EM rash is identified, and even when a test is positive, which is not all the time because the tests are not completely accurate. And in that case, people may be treated effectively and accurately, but that does not always happen. And so many people are left with longer-term problems because the disease was not picked up in the earliest and most curable stage. And so they will develop longer-term, more protracted disease. And essentially, many doctors do not know how to identify that. It is a multi-stage, multi-systemic disease, and it is very hard to identify, and a physician really needs to spend hours clinically to recognize it, and also to look at other diseases, to more or less have a diagnosis of exclusion. And if you look for everything else and everything else is negative, and you happen to live in an endemic area, then a physician really should consider that this could be Lyme disease and try the treatment. And I can tell you story upon story about how that has happened to people, including my own father, where they thought that he had Parkinsonism. And we went from neurologist to neurologist, and we tried a variety of different drugs. And in the meantime, we had to run a spinal tap and a variety of Lyme tests because I suspected something was happening. Finally brought him to an infectious disease doctor here on Long Island and asked, what is the difference between central nervous system Lyme disease and this Parkinsonism that everyone seems to think he has? And the doctor said that the symptoms were actually quite similar. And so I said, well, then tell me, if 2 of his daughters, his wife, 3 of his grandchildren all have Lyme disease, and he's been playing on the same beachfronts and backyards as they have been, why wouldn't you consider that it's Lyme? He laughed and he said, well, you know, maybe we can try a treatment. And I said, would you consider trying him on IV to see if he does respond? We had a conversation and went back and forth, and eventually he did agree to do so. My dad took 4 months of IV, and essentially I got my dad back. And he's been on and off orals for quite a few years. Sometimes he'll relapse a bit, but we're very lucky, and I'm very fortunate to have my dad back.
What about the health insurance? Did the health insurance people pay for your father? What about other fathers and mothers and children having chronic Lyme disease and needing this long-term treatment?
That is a very serious issue because there are 2 sets of guidelines, medical guidelines. Both are on the National Clearinghouse guidelines, which is part of Health and Human Services. Both are listed there. Yet most physicians follow one set of guidelines and not the other. If you might consider the fact that these 2 sets of guidelines are vastly different. One provides for very short-term care, and one provides for longer-term care. So you can essentially imagine that if you've got two sets of guidelines and one group says that you can only treat for 3 weeks and the other group says you treat until the symptoms resolve, and that could be a year, and that could be 6 months, and that could be 3 weeks, but treat until those symptoms are resolved. So you might imagine how difficult this is, because insurance companies, if they're going to use one as a standard of care, would certainly prefer to use that standard, which provides for far less care because it's far less costly. And so it's important for people to be aware of that, those two sets of guidelines, and to bring that to the attention of their insurance companies. Many people I know, including myself, have had to address these issues with their insurance companies. And if you can do so providing this kind of proof, then sometimes you can reverse the decision and get the insurance companies to cover the cost of treatment.
Time for Lyme. What does the group, what does the organization do?
We are basically a research and education advocacy network. And we essentially do a great deal with education. We educate school children. We have created a curriculum in partnership with Greenwich Public Schools, which essentially educates kids in kindergarten and 3rd grade, again in the middle school in 6th grade, and in 9th grade in the high school. And it provides them with education, what the ticks look like, where they are found, what should you do if you find a tick on you, and eventually getting into the high school level where we actually talk about what you might feel like if you have Lyme disease. What are the social, emotional, and psychological ramifications of Lyme disease? And we feel it's so important to educate these kids. And some of the early work we did, we'd get into the school systems and we'd actually work with the kids. And it was just so fun to get letters back from the kids saying, "Thank you so much. My mommy did a tick check on me tonight, and she always checks us now, and we found a tick, and we were in a swampy area, and there were lots of ticks, and now I know better." It's very exciting to do that. So that is very important to the organization. But we also do raise funding for research. And we have worked very closely with the Lyme Disease Association, which is the umbrella organization for Time for Lyme. There are about 27 affiliates all over the country that are working with the Lyme Disease Association, which is based in New Jersey under the direction of Pat Smith. And we have been working collectively, the LDA and Time for Lyme, to open a center at Columbia University, of which we have just officially done. In April it was officially opened. We reached our $3 million mark of research funding, and the center became official. And one of the first goals of the center is to look at finding a good gold standard test so that we can tell immediately if you are sick and, in fact, if you are well.
Cindy Berenbaum, you're a social worker in Brewster, New York, and a lot of the people you take care of have Lyme disease, and it's not an ailment you can get over like a common cold in a couple of weeks, apparently.
Yeah, I'm a licensed clinical social worker. I have a psychotherapy private practice in Brewster, and I have been in practice for over 20 years. And my specialty has, over the years, become Lyme disease, serious chronic neurological Lyme disease, and its effect on families. I see adults, I see kids. It's not an illness unless it's diagnosed early, treated efficaciously right from the beginning. A lot of people are suffering for a lot of years.
These people that you're helping, the circumstances that they're living under because of Lyme disease.
One of the unusual things about Lyme disease compared with another illness, say diabetes or heart disease, is that very often it afflicts more than one person in the family. Everybody in the family has gone camping and picked up been bitten by ticks, or everybody in the family has the couple of dogs that run outside and that sleep in the kids' beds. So so the whole family is dealing with several members of the family, not always everybody, but several members of the family being ill. So that's a major stressor for the family. The symptoms, the symptoms that I see are severe fatigue. The fatigue has been seen by some researchers to be more profound than congestive heart failure, more debilitating than congestive heart failure. Sleep disorders are very common. Anxiety, I see a lot of anxiety in the kids. If the co-infection Bartonella is involved. You often see the rages or mood disorders, severe mood swings that somebody may diagnose as bipolar disorder, but really is just due to the way that the infectious agent Bartonella operates in the brain of the patient. So these are pretty severe symptoms. Sleep disorder is very, very, very common. So you have a family member or a few family members that have an array of symptoms. It's a multi-system illness. And you have people trying to go to work and go to school and having a very limited ability to function. With the adults, they at least had a life before Lyme. If the kids were very young when they were bitten, then you have an array of problems that's very unique. They don't remember, some of them don't remember what normal was. We don't know, their parents don't know whether they would have had attention deficit disorder, would have had dyslexia, would have had information processing problem, would have had a visual tracking problem, or any of those types of disabilities if they had not gotten bitten by the tick. So, however, you have to deal with what you've got. You've got to deal with the array of symptoms that the child has, and the parents find themselves having to go to school, very often asking for accommodations that are entitlements under special ed law, under the Americans with Disabilities Act, and they ask that their child be classified so that they can receive the services in order to learn, to level the playing field. And the school districts in the most Lyme endemic areas are so overburdened with these requests, because there's so many kids that are sick with chronic Lyme, that sometimes there's a contentious relationship between the school district and the parents. So here we've got overburdened parents taking care of ill children, taking them sometimes long distances to get medical treatment from one of the very few experts in chronic Lyme, and they're fighting insurance companies very often in order to get the treatments paid for. And at the same time, they may be ill themselves, and then they're going to school to have these meetings and to fight for really the very education and the very life of their children.
If I might say, I mean, this is a medical nightmare.
It is a medical nightmare. It absolutely is. I have gone into school districts as an advocate with some of my families that come to me, some of my clients. I've gone into school districts and sat in on meetings with parents in two states, in both New York State and Connecticut. I have clients coming to me from 3 states. I have one client that comes from New Jersey, but I have people, I'm right on the border. I have people coming long distances. And sometimes the degree of misunderstanding and the degree of blaming that comes from the school is very painful for parents to experience. The schools should ally with the parents in trying to educate the children, and I've seen some pretty nightmarish situations.
Now, as a social worker, you're in the health field.
Well, I'm a psychotherapist.
Psychotherapist, mental health field.
Yes.
But in the general health field is something that you're involved. I mean, what does this say about the way sick people are cared for in our society?
Lyme disease is unique. I've said this in presentations that I've given. There's a lot more understanding from the community, from the schools, from the extended families for when you have a child with leukemia, when you have a child with another cancer, when you have an adult fighting breast cancer, when you have somebody fighting heart disease. There's a lot more understanding, a lot more support, and a lot less negative judgment. Lyme disease is unique. There is a major problem involving Lyme disease that where there's no parallel. It's probably the closest parallel is the way AIDS was many years ago. before when the AIDS community had to fight to be heard and fight to get adequate understanding and treatment.
I mean, like, what's the problem?
The problem is money. What I can see, the problem is two things: money and power.
Recently, Suffolk County Legislator Edward Romaine held a public meeting on Lyme disease.
It was common for people in East Hampton to drag one leg because they had this thing called Montauk knee, which was probably early cases of Lyme disease, and East Hampton had the higher counts, and eventually it migrated to Shelter Island. The town of Shelter Island many years ago brought in a biologist, a tick specialist, to come in and help us with funding that we need for the next 4 years. So when you mention that figure, people, a lot of officials, $1 billion. So divide that out over 4 years, and it's really nothing. It's a scrap compared to the cost of medical assistance and the damage it's done to people's lives. One person could lose that much in their lifespan from being damaged by this disease. I know young men that I grew up with incapacitated to this day from chronic Lyme disease. They can't walk. One of my neighbors has both hips and her knees replaced from advanced arthritis caused by the Lyme disease. And you see it all the time with young children with their knees swollen and they can't walk or function. People that were extremely intelligent can't remember the words in the sentence. By the time they get to the end of the sentence, they forget where they are. So I just think that we need to address this at the highest levels of government, and the funding has to...
I urge you all to encourage any doctor you know to go to the LDA and ILABS conferences. 3 days of phenomenal learning. The end of October, what are the dates, Joe? In Boston? You have the dates, Diane?
It's the end of October, weekend of October 26th. It's a Friday, Saturday, Sunday conference. Also, the conference includes doctor educational seminars and DVDs that they can get while they're there, or if they can't attend, they can buy them. Very often our patients will buy them and bring the discs to the doctors to say, please look at this. So you can be active, and you have to be active. There's a group in Pennsylvania called Tofu. People have been fed up. And this is true. They wear their green outfits, they go protesting, they make a lot. So I like your strength and your drive, because people like you make a difference. Thank you.
Thank you, Doctor. Please.
Ava, wow. We're getting something started here in Suffolk County. Thank you, Ava. Thank you so much.
Not without a lot of people's help.
Yeah, well, thank you. It's just amazing. I just want to show you, and I don't mean to, but my 3 kids, okay? I raised them by myself for 17 years. I was married up until 8 years ago when I was divorced. November of 05, my 2 younger ones were diagnosed with Lyme disease. My youngest had positive tests, and she was 5 that I wasn't told about. I tried to get a 504 for a year and a half. My ex-husband consistently called the school and said there's nothing wrong, although I had very specific documentation to support a 504. My son was eventually put on a PIMS program. CPS was involved. Actually, that was the 7th time CPS was involved because my ex-husband, was just one of those people. Anyway, I haven't seen my children in 3 weeks because I had 5 documents stating that I have chronic neurological Lyme disease from Dr. Amber Katz, 2 from Dr. Daniel Cameron, 1 from Dr. Boye in Stony Brook, and Roxanne Kapoor. 1 I did not concur Dr. Kara Horoth. She submitted to the courts that I have a delusional factitious disease, somatic in nature, and I'm passing it on to my children. I ordered an immediate removal of my children from my home.
It's not just a controversy, it is an absolute war. We have doctors from the other side and scientists from the other side calling our doctors buffoons. And this, I wouldn't say this except that it is in a recent article, you know, where our doctors and our scientists who tell our story, and I can't even tell you how patients have been denigrated.
Oh, I know.
And it's, you know, it is a sad state of affairs, and we wouldn't have to be here if patients were not being denigrated. But we are being denigrated, and we are being told that there's something wrong with us. In some kind of a bizarre way, there's something wrong with us because we're sick.
I want to thank you for your efforts to spread the word, and we're going to hear from our last speaker. Thank you very much.
Thank you, Mr. Romaine. I do have some serious questions about the antibiotic treatments. I myself have Lyme's disease. I started with the classic bullseye and 104 fever for 10 days. Before I went to a doctor, I thought I just had a flu. I found out that I did have the classic bullseye, which I couldn't see. It was in the back of my leg, and I was too sick to really even look at it. I did a month of antibiotic treatment. I felt much better. It took a long time for me to get better, but I did. Again, I got 2 more tick bites last year. I removed one. I just found out badly because I didn't get the whole thing out, and I had a doctor remove one. They gave me 1-day treatment of antibiotics.
Answer these questions. First of all, those who know how the ILAD's approach to Lyme goes knows that Lyme treatment involves much more than just taking antibiotics. It involves getting the person as healthy as possible so that the body fights the infection, the antibiotics help to fight the germ. So, for example, we always advocate a low-sugar diet. We always advocate anti-yeast measures. We always advocate exercise. We always advocate enforced rest. We do those types of things. And Lyme liquid physicians don't just know about the antibiotics and the blood tests. They know about all these other vitally important supportive treatments. In fact, if you were a new patient in my office, I would probably for the first few weeks treat things such as your nutritional status and make sure you're doing all the proper things to get your body healthy before you even gave you the antibiotic. Now, the reason why this is so important, in addition to all the obvious, is because the IDSA, Infectious Disease Society guidelines, prohibit the use of supportive therapy. They don't talk about using low-sugar diets. They don't talk about any of that kind of thing. So if your doctor or doctors follow those guidelines, they're not only giving you the wrong medical treatment, they're giving you the wrong supportive treatment because they're not giving you any.
State Assemblyman Fred Thiel, you have had a bill in Albany to require health insurers to pay for long-term treatment of Lyme disease. It's not gotten very far.
Well, but I think that we're gaining on it. I mean, I've had, you know, certainly there's a lot of support from Long Island, also a lot of support from the Hudson Valley. As you heard, some of the highest statistics as far as Lyme disease are in Ulster and Dutchess County and those areas. So, but it's as I said tonight, it is a big battle because lobbying against this legislation, you have all of the insurance companies, you have a lot of the business lobbies who don't want to have increased costs to pay for increased insurance costs, and they line up against legislation such as this. So it really does take a prolonged and dedicated citizen advocacy program to really have success with these pieces of legislation.
I mean, it can almost be considered politically sick that this legislation that you've authored and you've sponsored to help people who are, I mean, it's an epidemic situation, Lyme disease, and here your bill is stuck.
Well, another perfect example, and I mentioned it also this evening, mental health parity as far as health insurance goes also, so that people have coverage for mental illness. That seems like a no-brainer also, but it took almost a decade to be able to get legislation passed on that. And you can't underestimate really unfortunately the influence of special interests on the legislative process in Albany, and really what it's really kind of away from the issue of Lyme disease. but we need to take the influence of money out of politics, because it's campaign contributions that come from the pharmaceutical companies, come from the insurance companies, come from big business that is skewing the process. So a piece of common sense legislation like this doesn't get adopted as easily as it should.
Now, you live in an area, the South Fork of Long Island, which is a hotbed for Lyme disease. Can you just talk about some of your personal experience with people with Lyme disease?
Well, part of what we do as elected officials is constituent work. And never does more than a couple of weeks go by when I don't meet with a constituent who's having a problem, either getting medical treatment or having an insurance problem. It's endemic out there, not just on the South Fork, but Shelter Island and many locations on Long Island. It is something that it's good to see a meeting like tonight where people are getting organized and speaking with one voice, because that's what it's going to take.
Suffolk Legislator Ed Romaine has just organized a hearing, a public meeting on an epidemic, Lyme disease, and almost as problematic as Lyme disease, the problem of people getting treatment for Lyme disease when they have it for months and months and years and years. What is going on, Ed?
Absolutely. There's two problems that are going on. Many doctors are not trained to properly diagnose. Oftentimes, Lyme disease hides itself in the symptoms of other diseases, and it's very difficult to try to properly diagnose Lyme disease and other tick-borne diseases. The second problem is there is a very limited and prescribed treatment with antibiotics that may be good for some but not for all. And the insurance companies are behind limiting the amount of treatment. That's wrong, because people do not get cured. And this is a disease that stays in your blood system if not properly treated and can affect you, and you can get acute Lyme disease that can be absolutely debilitating. Now, we're talking about changing the perception, educating people, and educating doctors and insurance companies that additional treatment may be needed. Not all people respond to 2 or 3 weeks of antibiotics. In some cases, there are other things that ticks carry besides just Lyme disease that could be devastating if not properly diagnosed and treated.
You think the insurance industry, the health insurers, are going to respond to education, or might it not take government mandates to require them to help people, to provide for people who have long-term Lyme disease?
It's going to take, obviously, government mandates, because insurance companies have one goal, and that's to limit their exposure. They're looking to not provide as much treatment as may be needed. They're looking to just treat at a minimal level because it's more cost-effective, instead of something that could be absolutely debilitating, harm our productivity. We have literally thousands of people infected with Lyme's and other tick-borne diseases here in Suffolk County that are not getting properly diagnosed or proper treatment. That's something that has to be brought to light, something that our state legislators have to deal with when they deal with the insurance companies. I know that my state legislator, Fred Thiel, is working very hard to do exactly that.
What can people do?
People can get educated about Lyme's and tick-borne diseases. They could be aware of what they can do to prevent it. They can be aware of what the symptoms might be. So if they feel these symptoms, they should encourage their doctors to test for Lyme's, but not even the tests are accurate enough for Lyme's disease. It isn't always foolproof. So it's a constant system of educating people so they can be aware and they can seek proper treatment.
Besides the disease, what about the political disease here? The fact that evidently these health insurers are riding high, manipulating the political system, and people who have Lyme disease for 2 months and 6 months and 2 years and 4 years are just this. They're not getting support. They're not getting they're just not getting cared for.
Carl, I thank every day that we live in a democracy. Well, that's one of the reasons I had this public hearing tonight. That's why these people spoke out. That's why we had the experts here to speak about these things, to try to educate people. You know what? That's the counterbalance to what grabs our government today. We are too influenced, our government today. by the special interests, be it the insurance companies, the oil lobby, whoever, that pay people to provide information to our legislators, to advocate constantly. We have to counterbalance that with public education, and that's what tonight was all about.
Lyme disease, a medical nightmare. This has been a WVVH-TV special report. I am Carl Grossman. Thank you for watching.